Hi there, I'm Faye. As you wait to see your loved one's healthcare provider, I'm sure you have a lot of questions on your mind. Well, that's why I'm here. I'd like to tell you about FINTEPLA, an anti-seizure medication for those with Lennox-Gastaut syndrome, also known as LGS, aged 2 and older. You might find it helpful to discuss FINTEPLA and the other information I have to share in today's appointment with your loved one's doctor. First, I'll touch on the impact of seizures and why it's important to do what you can to reduce them. Next, I'll cover some important safety information before diving into how FINTEPLA may help reduce your loved one's seizures associated with LGS. Sound good? Let's get started. As a caregiver, you know that living with LGS means being ready for a seizure to strike. Seizures can happen on family outings or at home when you're just going through your routine. Those with LGS commonly experience regular seizures despite treatment with anti-seizure medications. In fact, up to 90% of children with LGS have uncontrolled epilepsy. Uncontrolled seizures can lead to devastating consequences, affecting things like motor function and cognitive development, which are important as a child grows and develops. And developmental delays can continue to impact a child into adulthood. Dangerous seizures, like those that lead to drops or falls, also come with a high risk of serious injury, even if they are not frequent. Even more serious, and sometimes hard to talk about, is the risk of sudden unexpected death in epilepsy, also known as SUDEP. People who experience generalized tonic-clonic, or GTC seizures, are at a much greater risk of SUDEP. In fact, the risk of SUDEP is 22 times higher in patients having 1 to 3 GTC seizures per year. Seizures can also take a toll on the entire family. Your physical, emotional, and financial well-being may become negatively impacted. So what does this all mean? That while finding the right combination of treatment may take time, it's worth it. Be sure to ask your doctor today about additional treatment options that could help reduce seizures. Because small steps toward seizure control can lead to big changes in your and your loved one's day-to-day life. Now, before we dive into how FINTEPLA can help address uncontrolled seizures, I just ask that you take a moment to read some important safety information. FINTEPLA can cause serious side effects, including problems with the valves in the heart, valvular heart disease, and high blood pressure in the arteries of the lungs, pulmonary arterial hypertension. Because of the risk of heart problems, your loved one must be enrolled in FINTEPLA REMS. They will need an echo test every 6 months while taking FINTEPLA to monitor cardiovascular safety. The monitoring can identify problems with the heart before symptoms arise. Please read the indication and important safety information for additional information about FINTEPLA, and please see the full prescribing information, including medication guide, at fintepla.com. Now that we've covered some important safety information, let's talk about how FINTEPLA may be able to help your loved one. For those with LGS, FINTEPLA may offer significant reductions of life-threatening seizures. These are seizures that can cause injuries from drops or falls. In a clinical study, FINTEPLA reduced monthly seizures resulting in drops or falls by 24%. By comparison, those taking placebo only experienced 9% reduction. FINTEPLA reduced dangerous seizure types, including generalized tonic-clonic, tonic, atonic, and tonic-atonic seizures. You should know that with FINTEPLA, lasting seizure reduction can be possible. 94% of patients who participated in the original 14-week trials opted to continue taking FINTEPLA in a long-term open-label extension study. Throughout this 15-month study, most patients maintained the seizure reduction they experienced in the original clinical study. 50% of patients went at least 7 days in a row without drop seizures, and 25% of patients went at least 17 days. Wondering about side effects? The most common side effects of FINTEPLA in clinical studies were diarrhea, tiredness, vomiting, sleepiness, and decreased appetite. FINTEPLA may also cause some serious side effects. These are not all the possible side effects of FINTEPLA. For more information, ask your healthcare provider or pharmacist. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. Like any caregiver, I'm sure you want to do everything you can to make sure your loved one is staying safe. When taking FINTEPLA, patients must be enrolled in FINTEPLA REMS, or Risk Evaluation and Mitigation Strategy. FINTEPLA is available only through the FINTEPLA REMS due to the risk of problems with valves in the heart, valvular heart disease, and high blood pressure in the arteries of the lungs, pulmonary arterial hypertension. This ensures they receive an echocardiogram before starting treatment, which can help you and your healthcare provider decide if FINTEPLA is right for your loved one. Your loved one will receive an echocardiogram every 6 months while taking FINTEPLA to monitor their heart health and identify any potential heart issues before they arise. This monitoring is a safety measure to identify any of these heart problems early. We've already covered a lot, but there are still a few more things you should know about FINTEPLA. First, FINTEPLA can be added to your loved one's treatment plan without making changes to their current anti-seizure medicines. This means you can build on progress your loved one has already made on other anti-seizure medicines. Second, in a clinical study, the patients on FINTEPLA did not experience worsening of behavior, emotion, or cognition. And finally, it's worth noting that with FINTEPLA, you're not alone. UCB offers support and services to all patients on FINTEPLA under the Onward Support Program.
Indication: FINTEPLA is a prescription medicine used to treat seizures associated with Dravet syndrome and Lennox-Gastaut syndrome in patients 2 years of age and older. It is not known if FINTEPLA is safe and effective in children less than 2 years of age. Important safety information: FINTEPLA can cause serious side effects, including 1. Problems with the valves in the heart, valvular heart disease, and high blood pressure in the arteries of the lungs, pulmonary arterial hypertension, have been associated with FINTEPLA. Your healthcare provider will do a test called an echocardiogram to check your heart and to evaluate for high blood pressure in the arteries of the lungs before you start taking FINTEPLA. Again, every 6 months during treatment and one time 3 to 6 months after you take your last dose of FINTEPLA. Call your healthcare provider right away if you develop any of these signs and symptoms of heart or lung problems during treatment with FINTEPLA. Shortness of breath, tiredness or weakness, especially with increased activity, lightheadedness or fainting, swollen ankles or feet, chest pain, sensations of a rapid, fluttering heartbeat, palpitations, irregular pulse, bluish color of your lips and skin, cyanosis. Because of the risk of heart valve problems, valvular heart disease, and high blood pressure in the arteries of the lungs, pulmonary arterial hypertension, FINTEPLA is only available through a restricted program called the FINTEPLA Risk Evaluation and Mitigation Strategy, REMS. Before you or your child receives FINTEPLA, your healthcare provider or pharmacist will make sure you understand how to take FINTEPLA safely. If you have any questions about FINTEPLA, ask your healthcare provider. Visit www.finteplarems.com or call 1-877-964-3649. 2. Decreased appetite and decreased weight. Decreased appetite and decreased weight are serious and common side effects of FINTEPLA. Your weight should be checked regularly during your treatment with FINTEPLA. Your healthcare provider may need to make changes to your FINTEPLA dose if your weight decreases. In some cases, FINTEPLA may need to be stopped. 3. Sleepiness, sedation, and lack of energy, lethargy. These are serious and common side effects of FINTEPLA. Taking FINTEPLA with central nervous system, CNS depressants, including alcohol, may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how FINTEPLA affects you. 4. Like all other anti-epileptic drugs, FINTEPLA may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your healthcare provider right away if you have any of these symptoms, especially if they are new, worse, or worry you. Thoughts about suicide or dying, trouble sleeping, insomnia, attempts to commit suicide, new or worse irritability, new or worse depression, acting aggressive, being angry or violent, new or worse anxiety, acting on dangerous impulses, feeling agitated or restless, an extreme increase in activity and talking, mania, panic attacks, other unusual changes in behavior or mood. How can I watch for early symptoms of suicidal thoughts and actions? Pay attention to any changes, especially sudden changes, in mood, behaviors, thoughts, or feelings. Keep all follow-up visits with your healthcare provider as scheduled. Suicidal thoughts or actions can be caused by things other than medicines. If you have suicidal thoughts or actions, your healthcare provider may check for other causes. 5. Do not stop taking FINTEPLA without first talking to your healthcare provider. Stopping a seizure medicine such as FINTEPLA can suddenly cause you to have seizures more often or seizures that do not stop, status epilepticus. Do not take FINTEPLA if you are allergic to fenfluramine or any of the ingredients in FINTEPLA. See the medication guide for a complete list of ingredients in FINTEPLA. Are taking or have stopped taking medicines called monoamine oxidase inhibitors, MAOIs, in the last 14 days. This may cause a serious or life-threatening problem called serotonin syndrome. If you are not sure whether or not you are taking one of these medicines, contact your healthcare provider. Before taking FINTEPLA, tell your healthcare provider about all your medical conditions, including heart problems, weight loss, depression, mood problems, or suicidal thoughts or behavior, kidney problems, liver problems, are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of FINTEPLA? FINTEPLA may cause serious side effects, including see FINTEPLA can cause serious side effects above. Serotonin syndrome. Serotonin syndrome is a life-threatening problem that can happen in people taking FINTEPLA, especially if FINTEPLA is taken with certain other medicines, including antidepressant medicines called SSRIs, SNRIs, TCAs, and MAOIs, tryptophan, lithium, antipsychotics, St. John's wort, dextromethorphan, tramadol. Call your healthcare provider right away if you have any of the following symptoms of serotonin syndrome. Mental status changes such as seeing things that are not there, hallucinations, agitation or coma, changes in blood pressure, tight muscles, fast heartbeat, nausea, vomiting or diarrhea, high body temperature, trouble walking. High blood pressure, hypertension. Hypertension is a serious and common side effect. FINTEPLA can cause your blood pressure to increase even if you have never had high blood pressure before. Increased pressure in your eyes, glaucoma. Symptoms of glaucoma may include red eyes, seeing halos or bright colors around lights, nausea or vomiting, decreased vision, eye pain or discomfort, blurred vision. If you have any of these symptoms, call your healthcare provider right away. The most common side effects of FINTEPLA when used to treat patients with Dravet syndrome, DS, include decreased appetite, diarrhea, low energy, respiratory infection, decreased weight, fever, constipation, abnormal echocardiogram, sleepiness, problems with movement, balance, and walking, increased drooling, increased blood pressure, vomiting, falls, seizures that do not stop, weakness. The most common side effects of FINTEPLA when used to treat patients with Lennox-Gastaut syndrome, LGS, include diarrhea, tiredness, vomiting, sleepiness, decreased appetite. These are not all the possible side effects of FINTEPLA. For more information, ask your healthcare provider or pharmacist. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Keep FINTEPLA and all medicines out of the reach of children. Please see full prescribing information, including medication guide, for additional important safety information on FINTEPLA.
Thanks for joining me today. And just so you know, the conversation doesn't have to stop here. If you're still waiting to see your healthcare provider, click on one of the links below to dive into the details of FINTEPLA. Or, if your wait is up, don't forget to ask your doctor about FINTEPLA today. If you still have questions, you can dial the number on the screen to talk to a live clinical nurse educator, or find me on the FINTEPLA.com virtual chat feature. See you there!